I'm Dr. Hilton Becker. Breast reconstruction following mastectomy has seen some major changes over the last few years. Today, it is possible for a woman to have her breast reconstructed at the time of the mastectomy, saving the skin and the nipple areolar complex, looking as good, if not better, than she did before the mastectomy. So this is a standard silicone gel implant that is used both in breast augmentation and breast reconstruction. This is what's called the cohesive or gummy bear implant. You can actually cut this implant in half and the silicone remains together. This is a standard saline implant which is filled with saline rather than silicone gel. Now in breast reconstruction we use tissue expanders. This is the most commonly used type of tissue expander. It is usually placed only partially filled and then filled after surgery. The way this functions is the expander is placed beneath the tissue. It is partially filled with saline at the time by placing the needle into the valve, and then saline is injected into the expander to stretch the tissues. There you see the filled expander which has stretched the tissues that have been left behind after the mastectomy. Once the right size has been reached, the expander has to be removed and it is replaced with usually a silicone gel implant. Occasionally it will be replaced with a saline implant. But it is a two-stage procedure. The implant that I developed is known as the adjustable implant. It is essentially a saline implant with a full tube attached. With the adjustable saline implant, we use an absorbable mesh to hold the implant in place. You can see the implant is still flat, there's no pressure on the overlying skin, and then the implant is expanded, the mesh holds it in place, it forms additional tissue over the implant, and eventually the mesh dissolves. The adjustable implant is filled after the surgery via the injection port. The injection port is buried under the skin. A needle is placed into the injection port, and then after the surgery the implant is filled with saline by injecting into the port. And you see the implant being filled until the desired size has been achieved. Once the adjustable saline implant is filled and the full tube removed, the patient has a saline implant that is left behind. If she wishes to change this out to a silicone gel implant, that can still be done. The reconstructive part of the surgery usually takes less than an hour. There is less pain because the implant is placed above the muscle. Furthermore, there are no animation deformities, that is abnormal movement of the implant after the surgery when the implant is placed above the muscle. Recovery is rapid. The implant is usually filled 1 to 2 days after the surgery, and total reconstruction is complete within 1 to 2 weeks. This is the saline adjustable implant that is fortunately available in the United States. This is the combination gel saline implant. It's called the 50-50, 50% gel, 50% saline. When the saline is added to the implant, the inner chamber expands. Thus it can be placed fairly empty and slowly filled. When the full tube is removed, you have a combination gel saline left behind. The next generation, also available only outside of the United States, is the adjustable gel implant. This is essentially a gel implant with a small inner lumen. This is used where there are very good skin flaps or in revision surgeries. The implant is placed and fine-tuning can be done after surgery to increase the size or to increase the projection to achieve symmetry. Once the correct size, projection and symmetry is achieved, the full tube is removed, leaving behind a gel implant essentially. This is the anatomical adjustable implant, also only available outside of the United States. It is a gel implant with a small inner lumen that can be adjusted to achieve symmetry and projection. Once the correct size is reached, the fill tube is removed, leaving behind the anatomical implant with the desired volume and shape. Today, with the skin-sparing mastectomy or the nipple-sparing mastectomy, women have many options available to them. Most commonly, the implants are placed beneath the muscle. Initially, a tissue expander is placed. A second operation is necessary to replace the tissue expander. And I see patients who have implants beneath the muscle who then want to have the implants placed above the muscle. Fortunately, today, we can place an adjustable implant above the muscle, all done in one stage without a need to replace the tissue expander with an implant. Not only is recovery more rapid, but it is less painful, patients often returning to work within 1 to 2 weeks after the reconstruction. For more information on the one stage above the muscle breast reconstruction with adjustable implants, visit our website at beckermd.com.